I mean, if you're asking whether by mentioning the novelty of this and the uniqueness of this and the cleverness of this to patients, will they actually go and demand, look, I want you to use that device on me? I think it's highly unlikely. I mean, patients come and they realize that all of us use very technically sophisticated things, and they trust the doctor to do what's best, and they're already terrified about a needle going in the eye. So I think the doctor says, look, there's a new way of putting this, and I really think that this works, and I like the results that I've had, they'll go for it.
Mm-hmm. Okay. All right. What other considerations should we be thinking about with respect to the attractiveness of this device?
I think the development of this product, like any other product at this point, is key. I think you need to. I mean, again, we have to presume obviously that it works. We have to presume that it's efficient. We have to presume that it's a drop. I think the key to success for pretty much everything, including this device in this day and age, is strategic development. We're not going to have I shouldn't say that. It's very unlikely for us to have a clear-cut, home run for something, a drug, device, anything. All of these things are going to be incrementally better. And whether they succeed or not is how one messages and develops that incrementally better. It's the same thing over here. I mean, we can sit there and spout about how much more efficient that is, but for the two guys in Idaho who may see 20 patients a day, I mean, are they really going to spend $5,000 on a device so they can have an extra 20 minutes at the end of the morning? They look at it and who the hell cares, right? So
yeah.
Somehow you're going to have to message and position this product properly in terms of the proper message that resonates not just with the people that you're going to talk to on the phone like me, who are high volume users, but who are your regular Joe Blow customers, the two guys in Idaho. And you're going to have to message to them and say, this is better for your practice, even though, I shouldn't say even though, but this is a practice where they may see 20 patients a day. Even for 20 patients a day, this is better because you'll have better patient satisfaction. You'll have more efficiency. Patients will come back and they'll say, look, I've been there for a year and I've never had any discomfort. It's the consistency, so on and so on and so forth. I mean, that's the messaging that I think you'll need to have once you have the proper data and development strategy. So I think the success or failure of this really depends on, assuming everything is positive data-wise, it really depends on your positioning and messaging.
And along those lines, with the patient comfort, I'm thinking about the ideal target patient. What are the characteristics of that patient? What is the appropriate patient pool, the appropriate target audience for this device, regardless of drug?
Well, it's everybody that needs an injection, quite honestly. I mean, I don't think there's a target profile but someone who needs an injection. But I think one of the points in our conversation that really is undervalued here is the consistency, and I said that early in our conversation. And I understand what you said when saying, look, patients may not have pain, they may be more efficient. All those things are important things. But I think we've really undervalued consistency in our conversation, and that's something that very few people talk about, but you may want to consider valuing that a little bit more and paying a little bit more attention to that as well. People will tell you, look, I did 50 injections today and nobody had any pain, and I don't use subconj, I use a Q-tip and so forth. I've heard that all the time, or I use a lidocaine gel and so forth. The bigger question really is, how many patients have you had for a year that you've done injections on every month, and the one time you've caused pain? Have there been patients like that? The answer is yes. And if you go and talk to those patients, and that's the thing that you should do, is talk to the patients, and they'll love their doctors, and they'll say, yeah, but I remember that one time it really hurt. They'll remember that one time. It's like stopping terrorists. You can stop people, 8,000 times a day, but the one time they get through, everything goes to hell. It's the same thing.
Right.
That's what I would